Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be going over pediatric hematology disorders. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. Go ahead and give it a thumbs up. You're going to love the video. Subscribe to my channel if you haven't done so already. And don't forget, I'm now offering Next Generation NCLEX review sessions, part 1 and part 2. You can reserve your spot by going to my website, nexusnursinginstitute.com. If you're a current nursing student, you're not studying for your boards, you're just trying to survive the program, you're trying to pass your test, I have something for you. I have audio lessons. Be sure to check them out by going to my website, www.nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, and Facebook. My handle is the same everywhere, Nexus Nursing, so be sure to check that out. All right, guys, without any further ado, let's get started. Pediatric hematology. First question. Okay, which infected child must be isolated from pregnant women? So if a woman's pregnant, which child must she stay away from if they have this infection? Would it be pertussis? Would it be roseola? Would it be rubella? Or would it be scarlet fever? What do you guys think? Very good. The correct answer is rubella. So rubella, also known as German measles, it has a tetragenic effect on the fetus. So if you are a nurse and you are pregnant and you're working on, the pediatric unit, if you have a patient that has rubella, sorry, you got to switch assignments. You cannot care for that patient because, again, it has tetragenic effects on the fetus. Which medication would you expect to be ordered for the patient with scarlet fever? Would it be acyclovir? Would it be amphotericin B? Would it be prednisone? Or would it be penicillin? So your patient has scarlet fever. What medication would you expect to be prescribed? Very good, penicillin. So scarlet fever is caused by group A beta hemolytic strep, okay? And what is group A beta hemolytic strep? What is it sensitive to? Penicillin. It's sensitive to penicillin. Now, let me ask you something. If you're, excuse me, if your patient is allergic to penicillin, what alternate medication would you expect to be ordered? Do you guys know on the live? Type in your answer in the live. Patient's got scarlet fever, you expect penicillin to be ordered, but when you look at the patient's chart, you see that they're allergic to penicillin. What do you expect to be ordered as an alternative? Very good, erythromycin. Very good. Now let's look at these wrong answer choices. Acyclovir, that VIR stands for what? Virus. This is an antiviral agent. Scarlet fever, what kills it? Antibiotics, okay? So not antivirals. Amphotericin B, what's that? That's an antifungal agent. Prednisone, that's a type of steroid. That's what? An anti-inflammatory agent. So for scarlet fever, we expect an antibiotic to be prescribed. And again, if the patient is allergic to penicillin, you expect something like erythromycin to be ordered. All right, a mother with HIV asks about breastfeeding. What is the best response? Would it be, it's not the best choice at this time? Would it be breastfeeding is the best option? Would it be HIV cannot be transmitted through breast milk? Or would it be breastfeeding is a viable option only if zidovudine is taken as ordered? Mom wants to breastfeed. She's HIV positive. What would be your response? Very good. It's not the best choice in this situation. And here's why. HIV can be transmitted through the breast milk. And so even though we love breastfeeding, that's usually our number one option. If mom's HIV positive, we're going to teach mom that she has to what? Formula feed. Now I noticed that One of you chose breastfeeding as the best option. Usually it is, but not this circumstance. I just explained why. 5 of you chose HIV can't be transmitted through breast milk. It absolutely can. And 14 of you guys chose breastfeeding is a viable option only. Ding, 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 ding. What did I tell you guys about all-inclusives? Don't ever choose them as the answer unless the question is asking you what's the wrong answer choice. Stay away from answer choices that include only, none, never, only, always, those type of answers. They're usually not the correct answer. Look at what it says. Breastfeeding is a viable option only if zidovudine is taken as ordered. Well, guess what? Zidovudine, that's an antiviral agent. That's not going to prevent the transmission of HIV through breast milk. So that's incorrect. The correct choice is that she's going to have to formula feed. All right, a child with Kawasaki disease is at risk for which complication? Would it be encephalitis? Would it be glomerulonephritis? Would it be myocardial infarction? Or would it be idiopathic thrombocytopenia? What do you guys think? Okay, most of you guys got the correct answer, and it's myocardial infarction. And you know, it's so weird because we're talking about children, and you're thinking about child that's at risk for having a heart attack, right? But yes, let's think about Kawasaki. What's going on with Kawasaki? This is where the patient's having chronic inflammation of the small and medium vessels, right? That chronic inflammation causes weakness of the vessels. That patient's at risk for aneurysm, they're at risk for stroke, they're at risk for myocardial infarction, because think about it, those vessels being weak and you're having blood flow, turbulent blood flow, right? Blood can start to clot. That patient can be at risk for myocardial infarction. Absolutely. All right. What is the primary therapy for sickle cell crisis? Type in your answer. What is the primary therapy for sickle cell crisis? While you're thinking about sickle cell, one more thing I want to tell you about Kawasaki. You know, we never give aspirin in peds, right? Kawasaki is one of those one of the disorders that we do. You expect to give, that patient's going to get IVIG and high dose aspirin in Kawasaki's. That's something else you guys have to know. All right. What's the primary therapy for sickle cell crisis? And it's fluids, hydration. Fluids, hydration. Let me see what else you guys put on here. You guys said pain management, rest, hydroxyurea, fluids, fluid replacement, pain control. Okay. All right. So, oh, that's not what I wanted. So the correct answer is hydration, IV fluids. And I want to talk to you guys about it because you guys have to understand this. If your patient's in sickle cell crisis and you have to choose one thing to do for your patient, just one, it's going to be fluids. It's not going to be oxygen. It's not going to be pain management. Although pain management is important, guess what? Once you give them fluids, that's going to help with the pain. So you're going to be helping with the pain by giving them the fluids. I want you to think about physiologically what's happening, okay? Patients in sickle cell crisis, so those RBCs, the red blood cells, they're supposed to be nice and round, right? They're supposed to be disc-shaped. They've turned into sickle shape, half moon shape. They're clumping together. They're blocking, they're causing obstruction for blood flow because they've clumped up together. They've turned sickle shape. The problem's not oxygen. The oxygen is in the hemoglobin, which is in the red blood cell. It's in the RBC. The RBCs are there. The problem is that the RBCs become sickle shape, and so blood is not flowing the way it's supposed to. It's not going to the tissues the way it's supposed to. The minute you hydrate that patient, the minute that patient gets fluids, all of a sudden, those RBCs that were sickle shape, all of a sudden go back to round shape and blood flow continues. Oxygen is being delivered to the tissues, pain decreased. You're addressing the oxygen and the pain problem by giving the patient IV fluids, okay? So when it comes to the primary therapy, it's going to be fluids every single day of the week. And it's very important. Those patients who are sickle cellers, you're going to teach them always walk around with a water bottle. Always take sips of fluid. If you have to be outside in the sun, you're going to be in warm weather. Make sure you're drinking more fluids. The patient has to be hydrated. They can't afford to become dehydrated, okay? All right, type in your answer. What are the top 3 therapy treatments for sickle cell crisis? So you know fluid's going to be one of them. You know hydration is going to be one of them. What's the other 2? Tell me the top 3 priority therapy. What are top 3 things you're going to do for your patient that's in sickle cell crisis? Very good. You guys are doing great on the live. And I told you guys what the top 3 was in my explanation. Everyone should get this correct. Fluid, pain, fluid, hydration. That's right. You got it. You got it. You give that patient fluids, and the fluid's going to help with the pain. The fluid's going to help with the oxygen. Your top 3 treatments are going to be fluids, pain management, oxygen. Very good. All right, your sickle cell patient is in vaso-occlusive crisis. What is your most important nursing intervention? Is it going to be pain management? Is it going to be providing a cool environment? Is it going to be immobilizing the affected area, or are you going to restrict fluids? What is the most important nursing intervention for your patient that's in vaso-occlusive crisis? Very good. Pain management. Pain management. Again, you give that patient fluids, you address the pain, you address the oxygen, and of course, you address their hydration status. I'm very happy no one chose provide a cool environment. Let me tell you something. Cold causes what? Vasoconstriction. If this patient is in vaso-occlusive crisis, that means those RBCs are sickled. They're clumping together. They are blocking. They are obstructing blood flow. Why in the world would we want vasoconstriction? Absolutely not, right? If anything, we want vasodilation. We would want warmth. So that's wrong. 5 people chose immobilize the affected area. Let me explain something to you. The reason we want patients up, we want them moving around, we want movement, is because with movement is increased blood flow. With decreased movement is decreased blood flow. Guess what happens when blood isn't moving? It starts to clot. Children who have sickle cell are at risk for stroke. And you're thinking they're kids. How could they be at risk for stroke? Because of the sickle cell. They're already at risk for stroke. So do you think it's a good idea for this patient who's in vaso-occlusive crisis for there to be stasis of the blood to even increase the risk of clotting? Absolutely not. So that's wrong. And then we know, I can't believe 2 of you guys still chose restricting fluid after I said a million times, we want that patient being hydrated. We're going to push fluids on that patient. We want IV fluids, lots of fluids. We want them to be hydrated. So the correct answer is pain management. I think the 2 people who chose restrict fluids, you just saw fluids and you chose it as your answer. All right, your patient's lab values show a significant increase in the hemoglobin A2. Which diagnosis would you suspect? Would you suspect beta thalassemia trait? Would you suspect iron deficiency? Would you suspect lead poisoning? Or would you suspect sickle cell anemia? When you look at the labs, you see the hemoglobin A2 is significantly increased. Very good. You would suspect beta thalassemia trait. Now, this is also known as minor, beta thalassemia minor. Now, this is not the disease, this is the trait. So you'd expect to see that patient have those mild symptoms of anemia, such as pallor, weakness, fatigue, poor appetite. 2 of you guys chose iron deficiency. First of all, the patient would have to have severe iron deficiency. And if they had severe iron deficiency, you would see that hemoglobin A2 decreased, not increased. So that's wrong. And guess what? That hemoglobin A2 would remain the same in lead poisoning and sickle cell anemia. You wouldn't see a change in either of those two. So the correct answer is beta thalassemia trait. All right, true or false? If iron is administered parentally, the Z-track method should be avoided. Is that true or is that false? If you're given iron parentally, you should avoid the Z-track method. True or false? False. You want that iron to go deep into the muscle. You're using Z-track method. You want to seal that medication deep into the muscle. And iron is very irritating. You don't want it seeping out, okay? So that is false. You're going to use Z-track method. Now, before I move on, a couple more things I want to talk to you about iron you absolutely must know. You're going to teach your patient, let's say they're not getting it parentally, they're getting it orally. If it's liquid, you're going to teach them to drink it through a straw because it's very staining to the teeth. To the teeth. You guys know I can't speak. I'm sorry. I have a speech impediment. I was born with it. There's nothing I can do about it. Forgive me. Teeth, okay? You're going to teach them that iron's very constipating, so they need to drink lots of fluids. They need to ambulate. They need to eat foods high in fiber. You're going to teach them that iron will make their stool very dark. If you don't tell them that, they're going to freak out. You're going to teach them to take iron on an empty stomach between meals. We don't want that iron competing with receptor sites. You're going to tell them to take the iron with ascorbic acid with vitamin C. And the reason that's important, vitamin C helps you to absorb iron. Okay, so those are lots of important things you got to know about iron to teach the patient or the parents. All right, true or false? Rocky Mountain spotted fever is caused by a mosquito. Is this true or is this false? What do you guys say? Okay, absolutely false. Absolutely false. So type in your answer. Which animal's bite does cause Rocky Mountain spotted fever? Which animal? Which bite causes it? Is it a hippopotamus, a dinosaur, a zebra, a frog, a turtle, alligator, eagle? What animal's bite causes Rocky Mountain spotted fever? Bear, thick, ticks, tick. Okay, tick. I saw bar. I think you meant bear. Tick, a tick bite. Now, Rocky Mountain spotted fever, this is potentially lethal. This can kill the patient, okay? You'll see the patient will have, so yes, it's caused by a tick's bite. They'll have a very characteristic rash, such as the picture that I had up. They may have chills. They may have headache. May have muscle ache, okay? Last question. Your patient's anemic. Which food choice would you encourage? Would it be orange, shrimp, spinach, or milk? Your patient's anemic. Which food choice would you encourage? Very good, spinach. Spinach is very high in iron. So you would encourage green leafy veggies because green leafy veggies tend to be high in iron, such as spinach. Now, two of you guys chose orange, and I'm assuming you chose orange because I talked about vitamin C and how vitamin C, the ascorbic acid helps you to absorb the iron. But if your patient's anemic and you have to choose between that vitamin C and the iron itself, why would you choose vitamin C? You can take as much vitamin C as you want, but if you don't have the iron, it's not going to be absorbed. So you're going to teach them to eat foods high in iron. Of course, we want vitamin C because that's what helps the iron be absorbed, but the iron is the key. So that's why you want them to have iron, but we're going to have vitamin C to absorb the iron. Shrimp, no, that's not high in iron. And milk, let me tell you something. If anything, milk decreases the absorption of iron. If you have a pediatric patient come in and you look at the labs and you see the iron is low, one of the first things you better be asking the parents, how much milk is this child drinking? Because milk decreases the absorption of iron. That's what could cause the patient to be anemic. So the correct answer here is spinach. All right, guys, let's see how you all did.